In Week 8, we're focusing on postpartum preeclampsia, a condition that can occur after giving birth. Preeclampsia is characterized by high blood pressure and often involves other symptoms like headaches, vision changes, or swelling. Postpartum preeclampsia can be dangerous if not detected and treated promptly. It's important for new parents to be aware of the signs and symptoms, and to seek medical attention if they experience any concerning symptoms after childbirth. Regular checkups and communication with healthcare providers are key to ensuring a healthy postpartum period. Let's take a moment to watch a short video titled Postpartum Preeclampsia. This video discusses a condition that can occur after childbirth, characterized by high blood pressure and other symptoms like headaches or vision changes. Understanding postpartum preeclampsia is important for new parents to recognize the signs and seek medical help if needed. The video aims to provide straightforward information to help individuals navigate this potential postpartum complication. Let's take a moment to watch a short video titled Postpartum Preeclampsia. This video discusses a condition that can occur after childbirth, characterized by high blood pressure and other symptoms like headaches or vision changes. Understanding postpartum preeclampsia is important for new parents to recognize the signs and seek medical help if needed. The video aims to provide straightforward information to help individuals navigate this potential postpartum complication. The most common time for postpartum preeclampsia to show up is within the first 7 days after delivery and can still appear up to 6 weeks after delivery. What you can do is keep a close watch on your blood pressure because high readings could be a warning sign. You should also be on the lookout for other symptoms like severe headaches, stomach pain, throwing up, changes in your vision like seeing spots, or swelling in your face and hands. If you start to notice any of these symptoms, don't wait. Call the medical on-call service provided by your healthcare provider's office right away. If for some reason you can't reach your healthcare provider, head to the emergency room and ask to be seen by an obstetrician. Make sure to tell the medical staff that you've recently had a baby. This is important information. They'll need to take care of you properly. It's really important to listen to your body after you've had a baby. If something doesn't feel right, getting help quickly is the best thing you can do for both you and your baby. If you're feeling unwell after having a baby, and it's been 6 weeks or less since you gave birth, there are certain symptoms that should prompt you to seek immediate medical care. These symptoms include a headache that just won't go away, changes in your vision, like seeing floaters or small spots, difficulty breathing, chest pain, heavy bleeding, really bad pain in your stomach, fever or feeling like you have the chills, swelling in your hands or face. If any of these happen to you, go straight to the emergency department. When you get there, go to the front desk and tell them right away that you've recently had a baby. This is crucial information they need to know to give you the right kind of help. If you suddenly start feeling symptoms that are more severe, it's a signal that you need to get medical help immediately. Watch out for the following severe symptoms. A seizure, which is when you can't control your movements, you might shake a lot, or even black out. Signs of a stroke, which can show up as a sudden weak and or numb feeling in your face, arm, or leg, especially if it's just on one side of your body. You might suddenly also get really confused, have trouble speaking, or can't understand what other people are saying. Another warning sign is if you suddenly can't see properly out of one or both eyes. And if you're walking and suddenly get dizzy or can't keep your balance, that's a red flag too. A stroke might also make your head hurt really badly out of nowhere with no known cause. If any of these things happen to you, don't wait it out. Call 911 as soon as possible. When you need to talk to your healthcare provider about something that doesn't feel quite right with your health, here's a simple way to explain what's going on. Tell your healthcare provider what you're feeling. For example, you can say, "I've been feeling," describe the symptom, like a headache or dizziness. It feels like, explain what it's like, is the headache sharp? Is the dizziness making you feel like the room is spinning, and it's been going on for, say how long? Has it been a few hours? A couple of days? Make it clear that this isn't normal for you. You might say, I know how I usually feel, and this is different. Then, ask your healthcare provider some direct questions to get to the bottom of it. What do you think could be causing these symptoms? Is there a test I can take that will help us figure out what's wrong? Remember, you're the expert on your own body. If something feels off, speak up. Your healthcare provider is there to help you figure it out. When you're pregnant, it's helpful to have someone you trust to be there for you, like a family member or a good friend. Think of them as your support person for your baby journey. Here are 4 essential steps to take with your support person during your pregnancy. 1. Learn the warning signs. It's important for both you and your support person to know the early warning signs that could mean there's a problem during your pregnancy. This includes things like swelling in places you wouldn't expect, headaches that just don't seem normal, or any kind of pain or feeling that doesn't feel right. 2. Make a plan. Work out a plan with your support person for what to do if you suddenly need medical attention. Decide on the best route to the hospital, what to take with you, and who to call. 3. Be prepared. If you have to go to the emergency department, your support person should be ready to help you get there as soon as possible. 4. Ask questions. It's easy to forget to ask important questions when you're at the hospital because it's such a busy place and everything happens so fast. Your support person can help by asking questions, or remind you what you wanted to ask, so that your concerns are addressed by the healthcare team. Having someone to support you through your pregnancy is reassuring. They can help with practical things, be there for you to talk to healthcare team, and it's always good to have a bit of company during this important time in your life. Welcome to our presentation on alleviating back pain through pain management training and other strategies. We extend our gratitude to Dr. Sydney Curls, a fertility and pelvic physical therapist, for her collaboration with the UC Irvine Maternal and Child Health Equity Project in developing this vital health information. This presentation has been designed to provide you with strategies that will help you alleviate back pain during your pregnancy, throughout the day and night. Let's start by discussing posture. You'll be surprised at how these small postural changes can help you feel better, leading to improved sleep. When you sit, think about aligning your body from top to bottom. Start by sitting on your sit bones, which are the small bones under your buttocks. This helps keep a normal curve in your lower back, which promotes proper alignment and evenly distributes the weight of your upper body, reducing strain on your spine. Think of it like a stack of books. If the books are balanced and stacked evenly, they stay upright without toppling over. Similarly, a natural lumbar curve aligns your spine so that the weight of your upper body is evenly distributed, reducing strain just like an evenly balanced stack of books. Avoid sitting directly on your tailbone, the lower part of your spine. Doing this can cause back pain and discomfort around your tailbone. To help maintain this proper alignment, keep your knees a bit lower than your hips when you sit. Lowering your knees below your hips encourages a slight forward tilt of your pelvis, preserving the natural arch of your lower back. You can do this by using a donut pillow or a regular pillow to raise your bottom slightly. This not only keeps your knees in the right position but also supports the natural curve of your lower back. A donut pillow can also help by relieving pressure on sensitive areas like the tailbone. By sitting on your sit bones, avoiding your tailbone, and keeping your knees below your hips, you'll be sitting in a way that's good for your spine, especially during pregnancy. Here are a few examples of good sitting posture. Sit with your back comfortably aligned. Avoid slouching or leaning forward excessively while keeping your shoulders relaxed and not hunched or raised. Ensure your hips are positioned evenly on both sides, avoid leaning to one side. This is important for maintaining proper alignment. Take breaks to stand, stretch, and move around periodically. This will help prevent stiffness and maintain proper blood circulation for overall comfort and well-being. During pregnancy, your body's balance shifts forward due to the extra weight in front of your body from your growing baby. This might make you feel like you're tipping forward. A common mistake is leaning back too much, which can lead to lower back pain. To help with this, try practicing good posture by standing with your back against a wall. Make sure the back of your head, shoulders, bottom, and heels are all touching the wall. Standing with your back against a wall for about a minute every day can help show you how to align your back properly, reducing discomfort and strain. Maintaining good posture while standing is important for keeping your spine strong and comfortable. Your head should be over your shoulders, which should be over your hips, and those should line up with your knees and ankles. Imagine there are straight lines from your ears to your ankles. Avoid locking your knees during this exercise. This alignment, known as plumb line posture, helps your spine stay strong and comfortable, reducing strain on your body. Remember, during pregnancy, as your baby grows, you may feel like you're tipping forward due to the extra weight in the front of your body. To counteract this, it's important to lean back slightly to distribute the weight more evenly. Sometimes, due to this change in your center of gravity, you might unconsciously adjust your posture by leaning too far back or arching your lower back. These improper adjustments can lead to an uncomfortable feeling of imbalance and put excessive pressure on your lower back, pelvis, and hips. A helpful way to practice good standing posture is by standing with your back against the wall. First, stand with your back against the wall. Then, ensure your buttocks, heels, shoulders, and head are touching the wall. This practice not only relieves strain on your back but also encourages good posture by supporting the natural curves of your spine and evenly distributing your body's weight. Imagine each part of your upper and lower body as a book in a perfect stack, with no part leaning too far back or forward. The goal is to keep everything in one straight line, promoting a healthy and comfortable standing posture. Here are a few examples of good standing posture. Keep your ears, shoulders, hips, knees, and ankles aligned in a straight line, avoid locking your knees, and visualize a plumb line from your ear going down to your ankle. Maintaining this alignment helps relieve back strain, promotes proper spinal curves for support, and distributes your body weight evenly. Ensure that no part of your body leans too far back or forward. Aim to keep everything in one line for a healthy and comfortable standing position. Taking regular breaks to stretch and move around can also support overall comfort and well-being. External supports during pregnancy, such as maternity belly support bands, belly support tops, and maternity compression leggings or shorts, offer relief and comfort tailored to expectant mothers' needs. A maternity belly support band can be really helpful during pregnancy. Its main purpose is to lift your baby bump up, which not only relieves discomfort, but also promotes a better, more upright posture. This support band works by providing strong support to your belly, countering the forward pulling weight of the baby. It's recommended to wear them during active hours but avoid wearing them constantly or during sleep to maintain natural muscle support. Some popular brands to consider are Baby Belly Band by Cabia, Belly Bandit, and Cerola. Cerola is a specific brand for SPD. SPD, or symphysis pubis dysfunction, is a condition during pregnancy where there's pain and discomfort in the pelvic area due to loosened joints. These bands can make a significant difference in your comfort and well-being during pregnancy. belly support tops are similar to belly support bands and provide gentle support to the abdomen without being overly bulky or too compressive. Belly support tops are a comfortable alternative option for providing gentle support to your belly. They are similar to belly bands and are suitable for less active periods or when you find belly bands uncomfortable under your clothes. They should be worn snugly without excessive compression and can be worn during light activity, rest, and sleep to promote comfort. Maternity compression leggings or shorts are designed to support your belly without being too compressive on it. Their focus is on providing compression to the pelvis, to aid in blood flow circulation, and manage swelling in the pelvis and legs. They also offer support to the perineum and pelvic bone, which can be helpful for conditions like SPD. These garments can be worn during light activity, rest, and sleep, and you can choose the right support based on your needs and activities to ensure comfort throughout your pregnancy. If the belly band feels uncomfortable, too tight, or too hot, these alternatives can provide relief, and you can even combine the belly support top with compression leggings or shorts for added support. Choosing the right external support based on your needs and activities can contribute to a more comfortable pregnancy experience. For a comfortable sleep posture while lying on your side, it's important to provide external support for your head, back, belly, and knees to maintain a neutral spine from neck to tailbone. Use 1 to 2 pillows under your head to ensure proper alignment with your neck and body. Avoid extremes in pillow height or firmness. Keep your head straight and avoid bending it too far to the sides. Relax your shoulders to reduce tension and maintain spine alignment, avoiding twisting or pulling them. Place 1 to 2 pillows between your knees to align your spine properly, ensuring they are long enough for full support. Support your belly with a pillow underneath to prevent sinking into the bed. This will reduce strain on your back. If side sleeping hurts your hips, consider using a pillow under your hip for pressure relief. You can also place a pillow behind your back to help you stay on your side comfortably if you're not used to side sleeping. These tips can promote a restful and comfortable sleep posture during pregnancy. When sleeping on your back after 20 weeks of pregnancy, it's important to support your head, back, and legs while sleeping. Use 1 to 2 pillows under your head to keep your neck straight and aligned with your body. Additionally, place 2 to 3 pillows behind your back to avoid lying flat, which can help increase blood flow to you and your baby. Ensure a 30-degree incline for safety. Lastly, place 1 to 2 pillows under your legs to relax your back muscles. These simple adjustments can help you sleep more comfortably and support your body during pregnancy. After 20 weeks of pregnancy, it's advised not to lie completely flat on your back while sleeping. This is because as your belly grows, sleeping on your back can put the weight of your uterus on your spine and back muscles, causing discomfort. Additionally, in the 2nd and 3rd trimesters, lying on your back may compress a major blood vessel called the vena cava, leading to feelings of dizziness and potentially reducing blood flow to your fetus. Therefore, it's recommended to sleep on your side during these stages of pregnancy. Keeping one or both knees bent can be helpful, and you may find it beneficial to place a pillow between your knees and another under your belly for added support. Using a full-length body pillow can also provide additional comfort and support while sleeping. To get into bed comfortably during pregnancy, start by sitting on the edge of the bed. Lower your head and shoulders gently, then roll onto your side with your knees together. Once you're on your side, adjust your position with pillows as needed to support your head, belly, and legs for a comfortable and restful sleep. When getting out of bed during pregnancy, begin by lying on your side. Drop your feet over the edge of the bed and use your hands to push yourself up into a sitting position. It's important to keep your knees together during this process to avoid putting strain on your body. This method can help you get out of bed comfortably and safely while pregnant. When rolling in bed to switch sides during pregnancy, start by lying on your side with your knees together. Roll as a single unit onto your back, maintaining unity of movement and avoiding strain. You can also perform a gentle baby pelvic bridge exercise by squeezing your buttocks and lifting your bottom slightly off the mattress, then lowering it back down while keeping your knees together. Shift your weight properly to prevent pain as you raise yourself. Then, roll to the other side while keeping your knees together for unity of movement. If you experience pelvic tenderness, using pillows between your knees can help stabilize the area while rolling onto your back, bridging, and rolling to the other side. This rolling technique, with knees together and maintaining unity of movement, supports pain-free sleep and muscle function. We appreciate Dr. Sydney Curls for working together with the UCI Maternal and Child Health Equity Project to create this valuable health information. Dr. Curls is a fertility and pelvic physical therapist who can be reached at 1-424-258-4674 or through her website drcurlsforthegirls.com.